Thank you all for joining our webinar today Learn how to get involved in the lead testing school and childcare program. We want to welcome you all as we share the benefits of participating in this program. First, we'll start off with our introductions. My name is Brooke Kelchin. I am a Natural Resource Specialist at the TCEQ, and I will be your moderator today. Our first speaker is Emmett Tossian. He is the Project Manager of the LTSCC program at TCEQ. And Shannon Evanchek is our second speaker. She is the Project Manager at Trupani Incorporated. Trupani works closely with TCEQ, and they help implement the LTSCC program here. Our agenda today will begin with the LCRI school and childcare requirements, a program overview, webpage and portal updates, program progress, and finally learning how you can get involved in the LTSCC program. The chat feature is disabled for this webinar, so yeah, once again, please use the Q&A box. Now I will be passing the mic over to Emmett Tossian. Thank you.
Thank you so much, Brooke. And thank you so much for all of you for joining us today. We have an audience of schools, childcare facilities, and public water systems today. So this next bit of information is going to be geared towards public water systems, but everyone please stay tuned because we have information for everyone. Also wanted to mention, this has come up lately, that there have been some companies that are claiming to be assisting with this program, but please keep in mind that this is the official LTSCC program that is completely free for all. So just be on the lookout for that as we get closer to LCR compliance. Just wanted everyone to be aware. So first, like I said, we're going to be covering some information on the lead and copper rule improvement requirements, which pertains to public water systems. So the LCRI is going to be requiring community water systems to conduct public education and lead monitoring at schools and childcare facilities beginning November 1st, 2027. And starting on November 1st, 2027, public water systems must submit a list of their schools and childcare facilities. And they must also complete public education and notification requirements, including information in the CCR. And there are some exceptions to the sampling of at least 20% of elementary schools and childcare facilities over the first 5 years. For example, some facilities built after January 1st, 2014 can be excluded, as well as facilities with full plumbing replacement after January 1st, 2014, and verification that the service line is not unknown, lead, or galvanized, requiring replacement. In addition, these requirements do not apply towards non-transient, non-community water systems. And just keep in mind that there are some differences in requirements for elementary schools, childcare facilities, and secondary schools under the LCRI rule. Right. So there are a few parameters for sampling protocol under LCRI. Both school and childcare facilities must draw 250 milliliter first draw cold water samples after an 8 to 18-hour stagnation period. It is best to avoid sampling taps where a point of use device is present. And while schools must collect a minimum of 5 samples for each school, childcare facilities must collect a minimum of 2 samples. The TCEQ has developed a tool to assist water systems in compiling their list of school and childcare facilities. We will be having a separate webinar where we go more in depth on this tool, but I will briefly show you what this looks like and some of the features that it has. The date has not been set for this next webinar, but please keep an eye out for an invitation where you can learn more about the helpful features of this GIS viewer. We'll also post a link to this viewer in the Q&A chat. So you can go ahead and start taking a look at that. And maybe if you have any questions, you can bring that to our next webinar. So first, I'm going to show y'all what this viewer looks like and how it ties into our data. And just keep in mind that this tool can be used to help make your list of childcare facilities. So I've already got the link pulled up here. So here's what the viewer tool looks like. So you can see these blue lines, blue spots are going to be the public water service area boundaries. The little seesaws, I'll zoom in here. Little seesaws are going to be childcare facilities that have been sampled in the program, and the little yellow dots are going to be the schools participating in the program. And I'll just go ahead and click on a random one just to show you here. You can see that, we've got the information for the school pulled up here, and the physical address, number of outlets sampled, and it has a link to our portal, and Shannon will be going a little bit more in depth on the portal in a bit. But just to show you here, once you find that school that you're interested in seeing, apologies, y'all, technical difficulties, but Shannon will cover a little bit more of the portal. So once that does load, though, and it normally is fine, you can go ahead and search that school name there, and you can view those sample results. But there are so many other things this tool is helpful for, so I do strongly recommend, if you are a public water system, poking around this tool here, or if you're just curious about how that map works and different results from around the state, it is a great tool to use for that. So definitely worth spending some time taking a look there. And again, apologies for that technical difficulties. I had it all pulled up for y'all and everything. Right. And going over sampling exemptions for LCRI and kind of how that ties into our program. When sampling is done under the LTSCC program, it does reduce the system sampling requirements under LCRI. Please note that this applies to the sampling requirements, not the system's public education requirements, which cannot be waived. But it definitely is a helpful, again, free opportunity for water systems to get ahead of their sampling. And thank you all. And I am now going to pass it off to Shannon.
Thanks so much, Emmett. So I'm going to talk a little bit more today about the program steps and what all the program entails. And as Emmett mentioned, we have kind of a variety of folks on the webinar today. We have some people that are coming from the public water systems, which is more in line with focusing on what the requirements that are forthcoming under the lead and copper rule improvements that Emmett just covered include. But then we also have some folks from schools and childcare facilities that are just interested in learning more about the program. And so, the information that I'm going to share about the program steps is helpful for both of those audiences because, water systems can support schools and childcare facilities in completing the steps of the program. And schools and childcare facilities are also the ones that are able to enroll directly themselves and sign up and then complete the 5 different steps of the program. So this program is funded through the EPA Voluntary School and Childcare Lead Testing and Reduction Grant Program, and it follows this protocol that EPA has put together called the 3 T's, which stands for testing, training, and taking action. And this program is built off of that guidance. It's managed by TCEQ with contractor assistance from Trupani since 2022, and it covers these 5 program steps. The first step being enrolling, which can be done online at txleadtesting.org or texasleadtesting.org, which has a link from the TCEQ website to sign up. So that enrollment can happen online. It can also happen over the phone. We'll share some contact information with you all as well for our helpline. That is a dedicated helpline for this program. And during that enrollment process, we collect facility information, contact information, and building age, and then we validate that data. And then we provide a confirmation email. That confirmation email includes the information for step 2 of the program, which is trainings and community notification. So in that confirmation email, we provide a link to an online program training along with notification templates that schools and childcare facilities can use to share their participation about the program with their community. After step 2, the next step is sample collection. And that step can be completed either through our field technicians coming out to the school and childcare facility, usually early in the mornings, and collecting samples before water is used in the building, or it can be completed through us mailing a kit that has all of the paperwork pre-populated for the school and childcare facility, the number of bottles that they need to collect samples at the number of different taps or water outlets in their building. And we actually will talk about that a little bit more in depth here in a moment, but we see about half of the schools and childcare facilities opt for members of our team to come out and collect samples, and about half prefer the kit option. And then the step 4 of the program is conducting the sample analysis and providing results. And so after those samples are collected, they go to a network of laboratories. Our average turnaround time is about 12 days to get the results back to the school or childcare facility, and then we provide the results. And then that ties into the 5th and final step of the program, which is taking action. So along with the sample results, we provide schools and childcare facilities an action plan to help understand the lab report information and figure out a plan to take action if needed based off of the results. So that can be, different things that they could consider, like removing a sink from service if it's not needed, or adding a certified filter that reduces lead, or considering a fixture replacement as well. And through this program, we actually provide filters and fixtures that meet some of the different requirements. They have to be lead free. They have to meet the Build America, Buy America standards. And so, we can actually provide, those types of tools like filters and fixtures to schools and childcare facilities as well. So that was a high-level overview there of our different steps of the program. And I'm going to actually now demo one of the tools that we have in addition to the TCEQ GIS viewer, which is a great tool to view all of the data spatially. But this program portal that I'm going to demo here actually is reflection of the database that stores all of the information for this program. And so it can also be a helpful tool for both water systems and schools and childcare facilities alike. So I'm going to go ahead and share my screen here. Can everybody see this okay?
Yes.
Okay, great. Thank you so much, Emmett. So this is available, the results portal, if you go to txledtesting.org. There is login information here for schools and childcare facilities that have signed up to participate in the program. They get a login to view information specific to their facility, photos of where samples were collected, sample results, things like that. And then this register for access is for schools and childcare facilities that are signing up for the program to get access for the first time. But what you want to kind of take a look at here is down on the bottom of the screen. It says access the public results portal. So that's what you're going to want to click here to view all of the results. And what that button pulls up is our public results dashboards. And so we have 2 different ways to view the data that's collected through the program. The first is the school and childcare facility tab. And what this tab provides is information on what we call a facility level. So for a single childcare facility, if we sample at ABC childcare facility, there might be 3 different sinks and drinking fountains where we collect samples from at that school or childcare facility. And so that's going to be available in the results tab, where there's going to be 1 row of information for each of the sample results. But on the school and childcare facilities tab, this is where we're going to get our high-level information, which is certainly helpful as water systems are thinking about developing their lists for the lead and copper rule improvements that are due, come November 2027. And so here you can see also some high-level statistics for the program. So far, we have 2,700 schools enrolled, a little over 2,000 childcare facilities enrolled, and have collected over 66,000 samples since 2022. And then you can see some of the information here. This actually houses over 30,000 schools and childcare facilities across the state of Texas. So you can see some of the first ones here that are available, their facility name, the facility type and grade level, which can be helpful for any water system folks on the call today that are thinking about getting a list of both schools, childcare facilities, and then for the schools associating elementary and secondary school data as well. Also, we have county information, program status, the number of water outlets that were tested, and then a breakdown of results that came back less than 1 part per billion, anything that tested between 1 to 10 part per billion, and then at 10 parts per billion or higher. Of course, we know that there's no safe level of lead in drinking water, but because 10 parts per billion is, a commonly recognized threshold for taking action, we've broken up the results that way just for a high level glance at the breakdown of results for a single school or childcare facility. We also have remediation information included on the portal as well. And so in this instance here for this childcare facility in the second row, we actually provided some filtration. And then we have the public water system name and ID available as well. For rows where that's empty, it's actually a situation where the childcare facility might have participated more than one time in the program, which we do allow. So in this case, you can see this information is the same facility that was actually sampled twice in the program. I believe for this facility in particular, they first sampled in 2022 and then sampled again in 2024. And so you can see that this R indicates that they re-enrolled in the program and it's their second time participating in the program. And that is helpful information because if we look at this childcare facility as an example, the first time that they participated, they had 6 locations that they tested, and 2 came back between 1 and 10 parts per billion, and 4 came back at 10 parts per billion or higher. It looks like they removed 2 of those locations, and then we provided them with some filtration. And then when they went and tested again, everything came back at less than 1 part per billion with these 4 results. And so, that information is definitely helpful to consider for, water systems that are looking at this information. But that's why we did not list the water system name and ID on the portal again, because it would essentially create a duplicate entry when it's actually one facility that exists. So hopefully that makes sense. You can use the filter feature and filter by water system name or ID. So if we take a look at this ID here and we went ahead and added a filter and pasted that in, it's going to take a second to load here, but we should be able to see that information pop up here momentarily. And maybe I'll just refresh and give that a second to load. While that's loading, I will talk a little bit about the results tab. And so the results tab includes information on all of the individual results. And I'm going to go ahead and give that a second to load there and open this up in a different tab and look at our results. So in our results, this is showing all of the different sample results. It does take a second to load just because there's over 66,000 samples that have been collected throughout the state. So it is just a massive amount of data and takes some time to load. But in a second, it all pops up and here's all of these sample results. And so this is where we see all of the individual results. And again, we can go in and we can filter by, county, by facility name. We can export that data to a CSV or a PDF for whatever information you're looking for. We'll go back here and we'll just drop this filter off. May have to troubleshoot this because these are some new updates that we've rolled out here. So we just want to take a look here. So we'll just go ahead and, make sure that all of this functionality is working. But essentially, these are the updates that we've made, adding in the public water system name and ID and the grade level and the facility type, and all of that information is helpful for filtering, exporting. Of course, you can always export to Excel and then do some filtering within Excel as well. So yeah, those are pretty much all of the updates that we have made to share this information. And with that, I will stop sharing my screen and let Emmett resume sharing the presentation. All right, great. So on the next slide, we're going to talk a little bit about the program progress. So I thought it might be interesting today to share some of the data that we've seen throughout collecting the sample results, because I think a big question when it comes to school and childcare sampling is, things like how much lead are we really finding? And so that's what I'm going to spend, some of the rest of the time that we have today to talk about. And of course, happy to answer any questions. So when we look at the program progress, some high level stats so far is that there's been about 4,600 schools and childcare facilities across the state that have signed up to participate in the program so far. There are tens of thousands eligible schools and childcare facilities across the state, and those eligible facilities include public schools and regulated childcare facilities. So private schools are not eligible for the funding that EPA provides for this program, which is important to note because with the LCRI requirements, public water systems will have to offer the sampling to for the private schools as well. But unfortunately, those facilities are not eligible for the LTSCC program. We've also made over 35,000 phone calls, both outbound and inbound, from different interested, schools and childcare facilities, members of the community, things like that on the designated program helpline. We have collected now over 66,000 water samples. So since this data was pulled, another 1,000 plus water samples that have been analyzed. And those samples are analyzed from over 57,000 different outlets or fixtures across the state. And so oftentimes, if a sink or a drinking fountain tests with an elevated result, we might go back and do some additional follow-up testing there. If they replace the fixture or if we provide a fixture replacement or a filter, and they choose to retest to make sure that intervention is effective, those samples, we can support as well through the program. And then we've provided over 7,000 lead-free fixtures and filters to different schools and childcare facilities across the state to help with that mitigation effort. And overall, 1.8 million children have been impacted at the participating schools and childcare facilities. I spoke a little bit about the sample collection process, but I wanted to touch on it again since our audience includes both public water system folks as well as school and childcare team members as well. And so for the sample collection process, we can either mail kits, so that kit includes the pre-populated chain of custody paperwork, a prepaid shipping label for the samples to go to the lab, or our technicians can come out and visit the school or childcare facility and collect samples. And we do see about a 50-50 split there. We have seen an increase in, some water systems taking interest in the program and having us and working with the schools and childcare facilities in their area that have signed up, and having us actually send them the kits so that they can support the sample collection with the schools and childcare facilities. And so, we're certainly open to those kind of collaborative approaches, whether it's our staff going out, whether it's the school or childcare facility staff collecting samples, or water system team members as well. As long as everybody is, on the same page and on board for that approach, we're certainly open to supporting that. And the other thing that I'll mention here is all of the sampling protocols that Emmett covered related to the lead and copper rule improvements of those 250 milliliter samples that need to be collected after an 8 to 18-hour stagnation period are the same protocols that the LTSCC program follows. So those sampling protocols are, one and the same there. Looking at a breakdown of some of our results, things that we found interesting, we wanted to look at the percent lead detected and the percent of lead that exceeds 10 parts per billion relative to the number of samples that we've collected. And so we were also curious to see if there's any difference between the results at schools and childcare facilities, because schools are often larger buildings. There can be more kind of dead ends in some of the plumbing infrastructure within a school. And so it was interesting to look at the breakdown of schools and childcare facilities and the percent detected to relative to the total number of samples collected, as well as the percent that's greater than or equal to 10 parts per billion. We actually see very similar trends between schools and childcare facilities. And another kind of notable takeaway in looking at this table is that we collect a lot more samples at schools compared to childcare facilities, even though we have a relatively equal split of schools and childcare facilities participating in the program. And the reason for that is simply that childcare facilities are smaller. The LCRI does require that minimum of the 5 samples per school, 2 per childcare facilities. The LTSCC program does not limit the number of samples that a school or childcare facility collects. Anything that's used that the school or childcare facility tells us is used for drinking or cooking, we can collect a sample there to make sure that all of those different water outlets are accounted for in the data and the report that's provided to the school and childcare facility. facility. So on average, I think we're somewhere around 7 samples collected per child care facility and 30 samples collected per school, off the top of my head, something kind of in the ballpark there. And so that's kind of why you see a lot fewer samples in that child care section of the table. And the last data takeaway that I wanted to share with everybody on the call today is taking a look at the results by outlet type. An outlet type, what we're referring to there is the different type of water fixture. So we have listed here things like refrigerators, bathroom faucets, drinking fountains, all the way down to kitchen faucets. And then we also called out a special type of kitchen faucet that we call kind of a kitchen pot filler. Sometimes it might be referred to as a kettle. And the reason that we kind of called those out as a separate type of water outlet is because we actually started noticing that there was a lot more often that lead was detected at any level of lead or even over 10 parts per billion within those kind of kitchen kettle pot filler style. And we did a little bit of a statistical analysis on this, and we found that relative to the baseline category of a refrigerator, first draw samples collected from a kitchen pot filler are associated with about 17 percentage point increase in the probability of meeting the 10 part per billion threshold. And, samples from other categories were also associated with a smaller increase, in the likelihood of having lead detected or lead detected at 10 parts per billion or higher. Last but not least, talking about how you can get involved now. So for schools and childcare facilities that are on the call today, for a public school or a regulated childcare facility, if you have not yet participated in the program, you're eligible to sign up and participate. And you can do so at texasleadtesting.org. And for any public water system folks that are on the call with us today, the next steps of how you can get involved to start to get ahead and prepare for some of these LCRI requirements is starting with sharing information about the program with schools and childcare facilities in your area. We have a program promotion toolkit. I can send the links in chat, or you can also follow up and we can provide those. And that contains different social media graphics, videos that introduce the program and is a really succinct version of what we covered today, postcard graphics, letter and email templates, and more. And then we can also meet with the our program team to work directly with you to develop a strategy to encourage schools and childcare facilities in your area to participate. We can talk about some of the outreach that we've historically done and talk about what different strategies might work. If you have upcoming community events where information can be shared, that can be a great option. And so this Calendly link here will allow you to book a time with our team to talk about a strategy for your community in particular. And our team can also support additional presentations about the program to community members. And then the last thing on this slide is talking about supporting enrolled schools and childcare facilities with sample collection. So, anybody that reviews training materials can collect water samples. So while we do have technicians available for on-site support, if schools or childcare facilities in your area are more comfortable with, for example, water system staff collecting the samples, we can work and coordinate between the water system and the schools and childcare facilities as well to make that happen and get more samples collected and get more schools and childcare facilities, having completed lead testing ahead of November 2027. And so, really the bottom line for water systems on the call today is that, working with the LTSCC program is going to, save time and money down the road for some of these LCRI requirements and take advantage of a great program that TCEQ is offering.